Good evening, everyone, and welcome to this important panel discussion addressing the rise of crime in Washington, D.C. and its impact on Black women and girls. I am Angela Richardson, and I am so honored to serve as the health chair for the National Coalition of 100 Black Women Metropolitan Washington, D.C. chapter. I'm so thrilled to have you all here tonight for this very important discussion. I hope you all are ready to dig deep and engage in what I know will be a necessary conversation where we all hope to look at the impact of crime on our mental health and find solutions to ensure a healthier DC for all of us. Before we get started, I would love to welcome our president, my president, Madam Eris T. Scales, to share a warm welcome and greetings with you all. Madam President.
Thank you so much, Angela, for that. And I just want to say thank you to everyone who is joining us from the White House down to the community, our local representatives here in DC with our Councilwoman, Christina Henderson. We have Gregory Jackson, who's from the White House. We have, I won't even name all the panelists because you know who they are. You've seen the flyers. You're here to hear from them and not from me. But what I'll say real fast is, as I think about this conversation, I think about something that happened not too long ago with me and my daughter. And we were on the phone and she said, Mom, I am feeling a certain kind of way now when I go out. I'm nervous. Sometimes I'm scared. I'm a lot more apprehensive. And she said, it's just feeling differently here for me in DC. And that touched me very, very personally. When I think about not just her feeling like she can't be safe in her own community, but the psychological effects that begins to have on a young lady, even on our young boys, on me as a seasoned, leader here in the city. It is touching all of us in so many ways. And so when we think about crime and we think about public safety, I am so excited to see us bringing together that impact and that effect that it has on our mental wellness, our health, our well-being, and all of that plays out in our communities. And so I am hoping that we're all here, not just to listen, but to collectively share solutions, to collectively ask questions, and that we are wrapping our arms around this next generation, that we're standing in tandem with our public policy leaders, as well as our elected officials, that we are not afraid to go out into the community and do the work alongside those who are advocates and activists on behalf of this work. So again, I just say thank you so much for joining us. This is our first event, our first convening of the program year, particularly as it relates to health. We have a full, robust lineup addressing education, economic empowerment, and additional health and advocacy conversations that we'll be holding throughout the year, and just continue to encourage you to support us as we are on this journey to improve outcomes for Black women and girls here in the nation's capital. Thank you all.
Thank you so much, Madam President, for those words. I couldn't agree more with those sentiments. As a Black mom, as a Black woman living in Ward 7, which I am a proud resident of Ward 7, I too feel the same way in my community. As much as I love my community, I want to feel safe in my community, and I want to ensure my Black son that I'm raising feels safe in the community. So thank you for really setting the tone for the conversation for this evening. Now I'm extremely grateful to see a former colleague and friend of mine, Gregory Jackson, join us for the evening. Gregory is the Deputy Director of the White House Office on Gun Violence and Prevention. He has been at the forefront of gun violence prevention for as long as I've known him. And I know that we all are incredibly grateful to have him join us for a few minutes on behalf of the Biden administration to provide some words. Greg, thanks for joining us. Oh, you're muted.
Oh, can you guys hear me okay now?
It's all good. We can hear you.
Can you hear me now? All right. Good to see you again, Angela. Thanks again, everyone. I see a lot of familiar faces. Jawanna Hardy, Ronald, and Christina Henderson. So many just amazing leaders in this space. And I just want to thank you for having me here. For folks who don't know, just a little bit about me. I'm not from DC. I'm what you call an implant, I guess, since I've been here for quite a while. But moved here after college with really just the passion to help make this world a better place, and a belief that through politics, we can shift things and address some of the challenges that our communities have faced for far too long. And while the work was always important for me and policy change was always important for me, gun violence became very personal for me in April of 2013 when I was shot in the Shaw neighborhood, caught in the crossfire. And I'll just never forget the bullet that hit me, hit 2 arteries, and arriving at the hospital and frankly being interrogated before I could even go into surgery. And it was frustrating to be seen as a suspect first and a victim second. The second thing that really stuck with me was when I did make it through my first surgery, turning on the news and watching a lot of the politicians that I worked for, frankly, over the years make excuses about how they couldn't take action, that now wasn't the time. And I was shot just 3 days after the Senate, the U.S. Senate failed to pass an enhanced background check or universal background check. And so that just lit a fire in me that knowing that I was passionate about politics and policy change, but also unfortunately going through this traumatic experience, that I should shift my focus to raising awareness around this issue and doing as much as possible to put heat on our national leaders to do what we know is harming so many of our neighbors and friends and families here in DC. So that's just a little bit about me. I definitely would love to share a little bit about what we're working on here nationally and hopefully how it can provide support for what's happening locally. This is the Biden-Harris administration has seen this not as just another crime crisis or another issue, but really the #1 public health issue that we're facing of this administration. We have seen more executive actions taken by this administration than any other president in history. And last year, we passed the Bipartisan Safer Communities Act, which was the first law to address gun violence in 30 years. So we're seeing historic momentum at the federal level under the leadership of the Biden-Harris administration. A couple key highlights, though, is that the Bipartisan Safer Communities Act includes $15 billion for violence reduction strategies. One part of that is adding an additional 14,000 school-based mental health professionals, adding $250 million for community violence intervention programs, and then resources that created the 988 hotline for suicide prevention, and I think everyone's aware of that was created as a part of this bill, and then also the largest investment in youth mental health in American history, whether that's the mental health professionals or funding around the Stop School Violence Act that was included in the Bipartisan Safer Communities Act. So we're watching really unprecedented levels of resources going into violence reduction strategies. This bill also included measures to slow the flood of guns into our communities. And I think it's no surprise here that in most parts of our neighborhoods and really across the country, the last few years, we've seen gun violence spike to the level of the 90s. But there's a real difference between what happened in the 90s and now. We had 100 million guns in America in the 90s. Now there's over 400 million. And so the presence of firearms is a huge driver. And unlike necessarily the presence of drugs and the presence of kind of organized crime that destroyed so many communities in the 90s, right now, our biggest threat is really the presence of firearms in too many hands. And so part of the Bipartisan Safer Communities Act enhanced background checks to make it a little bit more thorough for someone under 21 to purchase a firearm. Now, if you're under 21 in most states, you have to, they will check your juvenile criminal record and they will check your mental health records before approving that purchase. And since we made that change, and this last summer, we've already denied over 578 purchases due to extreme concerns. We also launched 4 strike forces that are focused specifically on gun trafficking. We know for too long, most of the accountability has been focused on the individual that possesses the gun, but we don't realize that, frankly, a lot of our folks in our communities are possessing guns out of fear, out of attempts to protect themselves or their families, and even illegal guns at times come from a place of fear and not necessarily a place of harm. But what we do know is that there are people that are profiting and are really making a great deal of money off of pushing guns illegally into our communities. And so our focus on gun trafficking is how do we get upstream and hold those accountable that are profiting by bringing these illegal guns into our communities. So those are a couple key things that are part of the Bipartisan Safer Communities Act. Highly encourage you to check it out. That's a huge thing that our office is working on implementing now because it was just passed this last summer. Another major effort for our office is improving services and resources for victims and families that have been impacted. For too long, and I'm sure I don't have to tell you, individuals who have lost a loved one or been harmed, they're going to GoFundMe, they're going to their families, they're going to their schools and their friends to help them navigate through that financially. And it shouldn't be that way. And so a big part of our work is how do we improve victim services, recognizing that if we can help people heal in a healthier way, that reduces the likelihood of them harming someone else or being involved in a future altercation. But also that frankly, it's the right thing to do. So we're doing a lot of work to improve victim services, the Victims of Crime Act funding across the country. And then we're also building out what is like a FEMA-style response to mass shootings or high concentrations of violence that overwhelm a community. And even if it's multiple shootings over a weekend, for example. So that's one area that we're doing as far as improving services and resources. Third, we're expanding partnerships at the state and local level to help advance solutions to address gun violence. We know that, in DC, there are a lot of challenges, but frankly, while we have so many laws that are doing the right thing to protect our communities, it's not the same in North Carolina. It's not the same in Virginia. It's not the same in West Virginia. It's not the same in Maryland, unfortunately. And so our office is actually building partnerships in states across the country to really push them to advance policy to make our communities safer. A few highlights is that in Maryland, just a couple weeks ago, we saw the announcement from the governor to create an office or center of violence prevention and reduction, as well as their own reforms to their victims' compensation. In North Carolina, we've helped them create their first office of gun violence prevention, and we're helping them do a large safe storage awareness campaign in the state of North Carolina to hopefully cut down on guns that are stolen and guns that are taken from the home to cause harm. And so through our partnerships at the state level, we're helping advance policy across the country that frankly we know weak policies in Virginia, West Virginia, North Carolina, Maryland, all impact what's happening here in the district. So if you want to learn more about that, all of that is under what's called our Safer States Agenda. You can Google it, and you'll see that there's 14 different policies that we're pushing in states across the country. And so far, we've seen 27 states step up and start to introduce new legislation and new changes in response to our Safer States Agenda. The last thing that our office has been focused on is identifying new executive actions and new solutions that we know can help when we think about addressing these crises. And we know that, frankly, the entire federal government has not been at the table, has not been providing the support and resources to cities and communities like ours in our hometown. And so our office is pushing them and asking them to do more. Just last week, we actually had an event with the Department of Education, and where the Secretary of Department of Education did an entire rollout about the urgency for parents to safely store their firearms. And as part of that, we prepared guidance for principals to send out through teachers and students and directly to parents about the importance of safe storage, as well as trying to bring more of education leaders into this fight to join the effort. And just a little bit about safe storage, if I will. One thing that we're seeing with youth violence across the country, and I see Commander here, who probably can speak more to DC numbers, is that unfortunately a lot of the guns are also coming from the home. When we think about school shootings nationwide, 76% of school shootings, the gun comes from the home. When we look at youth suicide, 80% of those guns come from the home. And when we look at unintentional shootings and injuries, 76% of them come from the home. And so as much as we're focused on preventing illegal guns, preventing new purchases from those who are in crisis, a huge part of what we're pushing other agencies across the government to do is to reinforce the urgency of safely storing and securing your firearms so that youth in the home or children in the home can't access it from their parents. So that's one example of kind of a new executive action and a new approach that the federal government is taking in response to this administration's leadership. So I know that was a mouthful. There's so much more that we're working on. This is actually day 131 for our office, so we're still a very young office, opened in September. There's a lot of you that I'm excited to meet and partner with, a lot of you that we'd love to have you here at the White House to learn more. But most importantly, we just thank you for all of your leadership. And I live on W Street in Anacostia, and so everything that you do keeps my neighbors safe, keeps me safe, and so I just appreciate everyone's commitment to this issue. So I'll pass it back to Angela, and thanks again for having me.
Greg, thank you so much. I did not even know all of this work was happening at the federal level. And it's so great to know that to see you at the local level, right? Working in the mayor's office, Office of Safety and Neighborhood Engagement, and see you move into this federal role and the impact that you're having in this new office, I think is just amazing. And it speaks to the person you are. And I think it's important to have survivors at the forefront of this work and any type of work that we're doing. So thank you so much for leading on behalf of us, behalf of the people who look like us, and ensuring that DC will become a state too. So those laws we can be a part of that conversation as well once we get statehood. That's another policy thing for us too. Go ahead, Greg.
One more thing, there's a lot of these resources that are designed to go straight to the city and go straight to community organizations. And so even though we're not a state yet, there's still a lot of opportunities to take advantage of federal resources. And I'm gonna give y'all a sneak peek. Next Wednesday, we will be announcing all of the federal funding around community safety from Department of Justice, Department of Education, and Department of Labor. And so there will be, a fact sheet and a press release and probably something on social media, but I just want to tell y'all verbally that next week will be a big week where we'll announce the funding opportunities for this year. And hopefully DC can lean in and get as much of that as possible to help save lives. So anyway, thank you again, Angela.
Awesome.
I appreciate it.
No, absolutely. Thank you, Greg. Thank you so much for that. And we'll make sure to share those resources in our recap following this panel discussion. So thank you so much, Greg. All right, so now that we've had some remarks from our friends at the White House, we've heard from myself and Madam President, I want to introduce my sister in health and policy and all things in the 100, Lori Amos, who is truly a rock star in her own right. And I couldn't think of a better person to lean on in terms of her expertise to be our moderator for tonight's discussion. So Lori Amos, who is our public policy chair for our chapter, will be guiding us through a panel discussion with some dynamic, thought-provoking leaders in our community and in our government. So I'm going to pass it over to Lori to kick off our panel discussion, and following our panel discussion, our fireside chat. Lori.
Thank you, Angela. And Angela, thank you so much for your leadership and pulling together an awesome program for tonight. Very much needed discussion. And so earlier this week, yes, bravo. Earlier this week, as Angela mentioned, I had the opportunity to sit down with at-large Councilmember Kenyon McDuffie. Wow, what an awesome fireside chat with him. And the purpose of the chat was to discuss critical issues around gun violence, safety, and how it affects our mental health. So before we dive into the panel discussion, let's take a look at the fireside chat. Sister Tiffany?
So slight we're actually going to kick off with our panel discussion. You're muted, Lori.
So I heard you say that.
It's okay. You know what? This is. I want people to know that we are a real chapter.
We are real
people, and we are not robots, right? So I'm from New Jersey originally. My mom is on the line, so I'm gonna give a shout out to Jersey, and I'm gonna be real right now. So we're gonna keep moving.
That's right. I was getting ready to say, when we move, we move.
The momentum is here. And we're going to keep moving. So
okay.
I'm going to pass it back to you, but I want to continue to make sure that our audience stays engaged because we have so many people in this webinar and the number keeps growing as I keep looking at participants. So Lori, I'm passing it back to you, but you all please engage in the chat and please drop your questions for the panelists in the Q&A section of the webinar. Lori, passing it back to you.
Thank you again, Sister Angela. Great leadership here. All right, so now let's meet our panelists for tonight's discussion. So first up, at-large council member Christina Henderson. Christina Henderson, an at-large member of the Council of the District of Columbia, is dedicated to breaking down barriers to success based on zip codes. With a background as a trusted political advisor, she has provided counsel on domestic policy issues affecting families and children to U.S. senators, D.C. council members, and education officials. Prior to her current role, Christina served as legislative assistant for U.S. Senate Minority Leader Charles E. Schumer, as she has a history of impactful work in D.C. government, focusing on education, equity, and common sense policy. Council member Christina Henderson, welcome as a panelist. Nice to see you again. We also have with us tonight, Tracie Daniels of Our Sisters Circle. Tracie is the president of Synergy Consulting, an organizational development consulting firm, and the founder of Our Sisters Circle, a nonprofit organization dedicated to promoting and advocating for Black women's mental health and wellness. Tracie, thank you so much for joining us. Wow, Jawanna Hardy of Guns Down Friday. Jawanna Hardy is the visionary founder of Guns Down Friday, an organization committed to creating positive change in Washington, D.C. and Prince George's County. Her dedication to community well-being and activism has earned her the recognition as a top 40 under 40 recipient and a Black Voices for Black Justice DMV Fellow. Congratulations, and again, thank you for joining.
Thank you.
Yes. Ronald Moten, a DC native and peace activist. Ronald Moten is best known as the co-founder of Peaceaholics, a highly effective gang intervention and violence prevention organization. His role as a political strategist for DC Mayor Adrian Fenty has contributed to his reputation as a local media mogul. Thank you, Mr. Moten. And Commander LaShay Makal, Metropolitan Police Department 7th District Commander. Commander Makal currently serves as the 7th Department Police District, covering much of the southeast quadrant of the city. Her distinguished career in law enforcement includes leadership roles in various units, and she has been recognized for her contributions, including being named Lieutenant of the Year in 2019. Congratulations on that honor, and thank you for joining us tonight. So let's jump into the panel discussion. But before we start the actual chat, I remind you that if you have questions, please use the Q&A function, and we will ask questions to the panel following the discussion. All right, so let's jump in. Our first topic is going to be on mental health implications. And so for the topic tonight, psychological impact on rising crime. Let's discuss the strategies for coping and promoting mental well-being. So Tracie, as the president of Synergy Consulting and the founder of Our Sisters Circle, your expertise in Black women's mental health is invaluable. how do you see the rising crime affecting the mental health of Black women? And what strategies do you recommend for coping?
Thank you, Lori. That's a great but very loaded question. And so we're going to slow walk this a bit because this is something that's very important to me and all of you that called in to this webinar to hear this important discussion. So I'll start off with some research, which is Black women are more likely than any other race or gender group to suffer from anxiety and depression, and even feelings of hopelessness. And I was listening to Sister Aries at the beginning of the session, along with Sister Angela, talking about their fear of safety. And so I was immediately drawn to a model that's widely known, which is Maslow's needs hierarchy, right? So we're talking about this hierarchy of needs and how we can reach self-actualization, which is supposedly the highest level of needs. Well, this model starts with a feeling of met needs around physiological needs and safety. Those are the first two needs that we need to get through on this model. And the way the model is designed, if we don't meet our needs for physiological and safety, then we never theoretically will reach love and belonging, self-actualization, and all those things. So when any of those needs are compromised, it creates some challenges that manifest themselves in mental challenges and disorders. So for Black women in particular, as I said, we are the most likely in the race and gender to suffer from anxiety and depression. Add to that, most likely to have comorbidity, which is multiple layers of these particular illnesses. And yet, we are the least likely to seek help in traditional therapeutic means. So what does that mean for us in context? How do we reach this audience? How do we reach this population? And so we have to be creative with our strategies. And so one of the things is helping to understand that the mind, body, and soul are all connected. So the mental challenges that we face transition and transfer into physical ailments. So we're treating the entire person. So when we look at that and examine that, how do we do what we say we want to do in the therapeutic world, which is meet folks where they are? So what are the challenges? What are the barriers that we're seeing in terms of reaching this population? Well, first, we need to understand that environment plays a huge role in the development and even exacerbation of these mental health disorders. And so when you have an environment or you operate in an environment that can be viewed as disruptive, to put it mildly, then you're likely to face, right, more mental health challenges. So how do we cope when it feels like our environment is not likely to change, or even worse, we don't feel that we have control over changing it? So part of the answer has to do with what we can control. And those are the things that we rest on. Those are the things that we should focus on. So one way to sort of control how we respond to our environment is change it. Well, that's one way, right? But that's not feasible. That's not something that everybody can do. You can't just move your environment. So the most realistic way is to challenge how we respond to the environment that we're in. And so how do we do that? We do that by seeking help outwardly and also working on ourselves inwardly. So when we talk about seeking help outwardly, what does that look like? It looks like reaching out, community resources. But what we know about Black women as a demographic group, we don't necessarily go to traditional resources. There is community and solace and sisterhood, right? We're going to go to our family, our friends, our social networks, those that are close to us. That's where the trust is, and that's where we're likely to go for help and support. And so when we think about community involvement, how do we connect those aspects of where the Black women are going for help to community resources? So when we talk about the social media groups, I know there's a big podcast out called Therapy for Black Girls. I think that's an excellent piece, and where we tend to find ways to kind of help us grow and help us process these things. There's some significant and wonderful Facebook groups out here. Of course, organizations such as NCBWDC are really leading the charge on how we view sisterhood and how we help each other. So those things are very important in terms of how we look outward. The inward piece, and this is where I'll close, the inward piece really relies on us. And how do we change our response to our environment inwardly? Well, that requires us to do our own work. And what does that look like? So that looks like practicing meditation, practicing deep breathing exercises, stress management, anxiety management techniques, connecting with those that we trust, and sharing and being vulnerable, engaging in alternative forms of therapy. And what I mean by that is activities that bring you joy and fulfillment. So whatever that looks like for you, if it's exercising, if it's art therapy, if it's music, if it's color therapy, whatever that looks like for you, leverage that, hold on to that, and use that to help build your sense of security up, sense of physiological safety up, and will ultimately increase your mental health awareness.
Oh, wow, that's amazing. Thank you so much for that insight and opportunities for us to be able to manage and to cope. But I have one question for you, if you don't mind, just a quick follow-up. If there were
Sure.
just 3 takeaways for someone that's listening to you tonight, just 3 things that people can just remember to do quickly, just like not planning or not scheduling to work out, or where they don't really have to think about it. What are those 3 things that you could leave our audience with?
So first is meditation. And meditation is whatever you want it to look like, right? There are several techniques, but it's whatever you want it to look like. It requires the connection of the mind, body, and spirit. The second is the power of connection. And like I said, connection in your communities, connections in your sisterhoods, friends, family, folks that you trust, and folks that you're able to share with. The third is belief in yourself, positive self-talk. That's part of that. How do I see myself responding to this environment? So those are the 3, if I had to, sort of prioritize for key takeaways, those would be the 3 for us to help ourselves.
Thank you. Thank you. Powerful. Thank you so much, Tracie. And so now over to Councilmember Henderson. From a policy perspective, how can legislation contribute to supporting mental health initiatives for Black women in the context of rising crime?
Well, thanks, Lori, and thank you to the team for inviting me. As chair of the Committee on Health, we've spent a lot of time talking about the intersection between public safety and public health. And in fact, we just had an oversight hearing this morning with the Department of Behavioral Health to talk about a variety of different issues. So I'll just point to a few things. So first and foremost, one of the things that we have been working on is around just access, mental health access to resources. Although DC boasts second in the country in terms of health insurance coverage, we know, especially when it comes to mental health, that doesn't actually mean access, because we have a lot of providers who don't accept any type of insurance at all, whether it be Medicaid or otherwise. They can make a lot of money from private pay and telehealth, seeing patients in other jurisdictions. And so we've been having some deeper conversations with the Board of Psychology and the Board of Social Work around what it would take in order to get more of their providers to actually accept insurance, particularly Medicaid insurance. So, how we push around parity. Because I don't like the idea that we could say to someone, oh, well, you have health insurance and this means you get X, Y, or Z, when in fact, there is no parity there, because you don't, to find a provider that is accepting your info, is just really difficult. So access is first. The second, we have also been spending a lot of time trying to invest in health infrastructure. So where the physical places where someone can go to see a provider. I think for some people, especially Black women, while telehealth might be a very convenient thing, they want to, they need to lay eyes on a person in person to understand their vibe, understand their body language, and before we can open up and start to begin to trust. And so, when we think about where providers are in the district, a lot of people, like, even down to if you need to go to a dentist, you're going to have to commute in some ways to get there. And so we need more providers in the areas of the city where we're seeing an increased number of individuals who are looking for it. So wards 5, 7, and 8. And how can we as a government make either incentives available in order to do that, or other things. We've also been investing in residential treatment facilities as well. So for some people, they've reached the point where they need some intensive care. And right now we don't have enough beds to handle that, particularly as it pertains to young children, young women, teenagers. And so that's something that we have been trying to work on as well. And speaking of young people, I think this is really where the conversation sort of has to start in some ways. We know that the pandemic was very hard on young people, and then you combine that with the rising levels of crime. We're seeing some behaviors that are very concerning, and frankly, Children's Hospital was raising the alarm about this well before we started to see some spikes in terms of youth being involved in violent activity. So they were seeing a number of young women who had eating disorders, higher levels of depression, and sort of, being treated in those ways. So we've tried to double down and invest around school-based mental health supports. But also this past year, we funded a student peer pilot program because we heard from a number of high school students, particularly young women, who said, I'm more likely to ask my classmate for help than I am to go see an adult, which, I don't need everybody getting their healthcare advice from TikTok. So how can we train up some peer supporters who we do this work already around sexual health? How can we train up some peer supporters who can provide some resources to their classmates, but then also if they do have a classmate who's exhibiting a little bit more concerning behavior and needing treatment, now you have a person who can hold their hand and walk with you to the office of the school psychologist or the therapist to make that happen. So those are just a couple of areas that we've been looking at. And I'll just add one other, particularly as it pertains to public safety as well. So I have a really strong focus in terms of maternal health. We did a year-long look at perinatal mental health. So what women who are pregnant are facing. There's already a lot of stuff going on, and you add crime to it. It is adding some additional stressors. But beyond that, there's also the physical component as well. When we look at the maternal mortality rate numbers in the district, it's not just women who are dying in the hospital or because a doctor didn't catch anything. We've actually had a number of pregnant persons who've been killed due to community violence, and that is impacting our maternal mortality rates numbers as well. So those are some things.
All right, well, thank you. Those are a lot of things. So thank you so much for your attention and focus on all of those issues that are concerning to Black women in the district, including the public safety and making the link between health and public safety. So thank you so much for your work in that area. And so we are going to move now on to our next topic, which is policing and community relations. And so we'll explore under community policing several models and how they're building trust between law enforcement and residents. So Commander Makal, with your extensive experience in various police units, can you share your insights on building trust in the community and the role of community policing models?
Absolutely. Thank you guys so much first for having me. This is a topic that's near and dear to my heart, so I will try to keep it brief, but I am very passionate about it. So it's been a space of both personal and professional growth for me. So this is my 20th year with the department. And as you mentioned earlier, I've spent the majority of my career working, managing and supervising units that their primary focus is to reduce violent crime through gun and drug interdiction. So I'll always start with saying that I do something here that you don't often hear leaders do, and admit that for the first part of doing that, I got some things wrong. And I got some things wrong when it pertains to how I was trying to build legitimacy and build trust in the community. And I think that all centers around legitimizing the work that has to be done. So obviously we understand that making arrests isn't the answer to our issues. However, there are incidents where that needs to happen. And I think the work that I've done in building trust and legitimacy with the community is legitimizing what that looks like when that work needs to be done. So growing up in the 80s, I'm a native Washingtonian. Growing up in the 80s, I saw my share of gun and drug related violence, experienced it in my own family. So when I joined the department, I thought that the difference I would make would be to do whatever I could to remove as much of that from the community as I could. So again, managing and supervising these units, we were going into areas where the data showed that that's where we should be. So the data is showing us that this area has the most shootings, the most violent crime. And we would go in and we would recover hundreds of guns, right? Hundreds of illegal guns. And, I celebrated that. I really considered that a victory. I was like, okay, cool. Every gun, every bullet, everything that we remove out of the community is one life saved. But I kept getting complaints as well. So I was torn because I was like, what? I think that I'm doing a good job. I think that this is what the community needs. So why am I getting, complaints? So I'm so serious about my craft. So, I just kind of dug deep into like what could be generating this, because I think that I'm doing the right thing. I think that we're doing the right thing here. We're doing as much as we can to make the best cases that we possibly can make when we have to make them. So I just happened to be at a training one day, and an individual was talking, and we're talking around community relations and building trust. And I can't think of who to give the credit to right now. This was not my own. I got this from someone else. But they just started to mention, how when a doctor's treating an injury, they don't just cut the leg off because the ankle is swollen. Like, they really do some research on the actual injury to find out what's needed there, and then they make adjustments. And I think hearing that was just profound to me. And I realized at that point what I was doing, that I needed to adjust, right? So we went back and we kind of altered our strategies and tactics in reference to how we approach the community. So the community, I believe wholeheartedly, knows who the bad actors are, right? So when they see you come into the community and you address specifically those bad actors, I think you build some legitimacy there. So what we did was we started doing our homework on the front end. So before we went into the community, we knew who we were going there to see, we knew what they were doing, and we knew what our approach needed to be in adjusting, to that. So I think when we started to do that more, I started to see the complaints lessen. Now, mind you, I didn't say they went away. Okay. There's always room for improvement. However, I saw a drastic difference, and not just with the community, but with the officers. I think they understood that, hey, yes, I like what we're doing, but it might be a better way to do it. So, so I think again, kind of tackling that, building legitimacy in the community and building trust starts with like legitimizing the work that we do. So I could talk about this forever, so I'll just leave it there. I'm still taking notes from Ms. Daniels. I think I need to call you after the webinar. But thank you guys again for having me. I'm glad to be here.
Yes, and Commander Makal, please, that's why we're here tonight. The community is here tonight. Feel free, you have a platform tonight, so don't hold back on us now. So please feel free to continue any discussions that you'd like to. And for the other panelists too, even though I may direct a question to the panelists, if you have any follow-ups you'd like to share, you may even question the panelists. It's okay. As Angela said, this is a conversation. This is community involvement, community engagement, and I want this to be a conversation. So please feel free to jump in any topic that we're discussing. Okay. And so, Commander Makal, if you have a follow-up for Tracie, feel free.
Just one quick question. If there is any data to show or any explanation to why we are less likely to seek therapy, I would love to know that, because I see that in myself. I see that in my family. Like, I can't recall anyone in my family ever saying, "Hey, I'm gonna go and see a therapist." It has this negative connotation to it, like it means you're crazy or it means something like that. So how do we break that cycle?
Thank you, Commander. And I appreciate that question. And you're absolutely right. So I'll answer in two ways. And Sister Christina kind of touched on it, right? Number one is the trust. It's the trust. And where we generally build our trust is in our community, right? Our families, our friends, and the church has been a big part of our community. So we tend to also go there for counseling, etc. The second part is, quite frankly, we want to trust people who look like us. We want to be around people who look like us. And there's such a huge disparity between or in the therapy community, counseling, mental health field, in terms of Black therapists, more specifically Black female therapists. Now that is changing, but it's really trying to seek out someone who we feel that we're going to be comfortable with, we're going to trust, and we're going to share. So those are the two things that are really the drivers behind that, aside, in addition to our upbringing and you know, the stigmas around what therapy can look like and should look like, which is why I talked about the alternative forms of therapy, because when I say traditional therapy, I mean the one-on-one with the client. There's so many different ways and modalities that therapy can be received: art, therapy, music therapy, and there are a number of eclectic ways that we can reach people, again, meeting them where they are. But those are the two primary reasons. How we break the cycle is by leading the charge. So we need to really be talking to our young folks about going into the mental health field and really putting our dollars there so that we can have more representation in mental health field, and that will in turn increase our trust and our safety and our engagement in what I would call traditional therapy.
Thank you. Ron?
Yeah, I was just like to add into that. You know, we do a job readiness program with DOES, and a lot of people who come in the program, a lot of them are Black women, and it's not that many of them don't have the skill set to get a job. Is that they can't keep a job because of all the things that they go through mentally, and you know, the things they got to deal with every day in this world, raising a lot of times children by themselves in a world with so much trauma and drama. But one of the things that I tell people is that we all need services. The only difference a lot of times between us and them is most of us have somebody we can pick up the phone and call that's going to give us advice, right? And not give us some wild stuff. And so get them to understand that we all need therapy. It's just that sometimes we have an advantage because of our network, and to include people and things in your network who are going to help you make the right decisions, right? So I think it's just important to do that, and also make sure from a policy perspective, like Ms. Henderson said, we have to have more culturally competent people in our community to provide these services, because a lot of times people who have not been through these experiences or don't have family members who have been through these experiences, it's hard for you to relate and understand the psyche of a person who's going through some of the things that you haven't been through.
Well, thank you, Ron. Any follow-up to Ron's statements or comments? And yes, and I certainly agree with Ron, because I can remember a time, even working in the public sector, where if you were seeking therapy, that was a negative to maintain or keep your job employment status. So I'm glad to see now, especially in our community, that therapy really isn't taboo, but there's a lot of work that we have to do to let people know that it's a good thing to seek therapy. It's a great thing to seek therapy, and that we aren't threatened or challenged with losing our jobs. All right, so thank you for that conversation. Commander Makal, thank you for that follow-up. All right, we are going to shift gears again, and we're going to transition now to policy analysis. So let's examine current crime and public safety policies in Washington, D.C., and evaluate their effectiveness. So Jawanna, from your perspective as the founder of Guns Down Friday, how do these policies impact the community, especially Black women and girls? What changes do you believe are necessary?
As far as policy,
Yes.
to be honest, I was just talking to Mo about that. I don't know too much about policy. I'm really in the community. I'm still learning about different laws and policies, but but I did want to comment on the therapy piece. My daughter attends American University, and she decided to stay in the area. But she came home for a weekend, and I let her drive my car to the local corner store. And she came home, and I drive a Tesla. So she came home and she said, "Mom, I witnessed a murder." And she said, and the car witnessed it too. So we played the video back, and I remember the video so vivid, of a young man, he was bleeding out, dying. So that's a whole nother story. But my daughter came to me and I was so frustrated, and she said, "Mom, I need to take a mental health break." And I said, you go to American University, it ain't no break. Like, I had a meltdown, and she's like, "Oh no, Mom, they have something where you can take a mental health break and it won't ding against your," and I come from, I'm not that old. So just, it just, when she said that, I had to think about all the stuff she had been through. And, and when she told me what the school was doing, I wondered, did they have it for other schools? And, I just was so happy that my daughter took some time for herself, and that the opportunity to take time for herself was there.
Well, thank you so much for that. So let's shift then a little bit, and not so much policy, but the work that you do with Guns Down Friday. Do you, and this is an opinion question, okay? So do you believe that there are, and I won't call them policies, but maybe like regulations or laws that help support your program? Or with something that you can lean on?
It's when it comes to policy, and when it comes to the ones that affected the most, I deal with gang violence. And like, we were just on a panel yesterday, and I feel like what's going on now, there's no laws, there's no policy that's being created. It's like the problems really don't exist. So it's just hard, like, because I sit real high and I sit real low. And when I sit low, I just don't see a connection sometimes. So yeah, like I said, I'm still learning with the policy piece, and how important it is, having people in certain seats. But it's just hard to see on the ground what's being changed, so.
Yeah, then that surely speaks to the part of the question around its effectiveness. If you're running a program and there are still issues around policies and what's available to you as a resource to make sure your organization is successful, that says that there's an opportunity for us to do some work in that area. And
yeah, I always talk about, like, Guns Down Friday. Everyone thinks this, I mean, it is a big time organization, but we bring in about 30,000 a year with what we do. I don't take a salary. Every time it goes to my students, the kids I work with. And, I don't talk about it a lot anymore, but, I was in the military, so I suffer with PTSD. So when I sit down to apply for a grant, or even, think about policy. It frustrates me, and at one point I had to decide, is this really for me? Because, I don't understand a lot of things, and just because I don't understand doesn't mean I'm not making impact. So, I'm still here and I'm still standing, still, trying to figure things out with my mental health. Everything I did for my mental health, I'm teaching the community. So, yeah.
Thank you, Jawanna. Ron, yes.
Yes, I want to just say that policy definitely is an issue, locally and nationally. In America, we do two things. We go from one extreme to the other. We went from mass incarceration of locking brothers and sisters up for nonviolent crimes to the far left, where no matter what somebody do, we shouldn't sit them down. I tell people all the time, jail saved my life. Over 30 years ago, I had to go sit down for a minute, and I went to college. I received my GED before that, and I came home and went into a program that helped me cease fire, don't smoke the brothers, and the rest was history, right? And everybody doesn't have to go. And fortunately, I wasn't like the many brothers who suffered from mass incarceration and got illegal sentences. And I tell people, when we fought against mass incarceration, we were not fighting to keep violent offenders off the street. And when I say off the street, I'm not saying that we should go and lock every violent offender for 20, 30 years. But the reason why we got to youth violence in our community to the degree that it is because we start coming with this mentality that no matter what a child does, we shouldn't sit them down for a minute. And we start following these narratives that people push in our community who are not from our community. Now we're in a situation where the empathy is going out the door to help get rid of mass incarceration, right? And people are saying, I don't care about nothing no more, lock them up, right? And that's what we'll get right back to mass incarceration, because people don't want the police to do their job. So the feds are coming in and do the police job. And when the feds come in, when the alphabet boys come in, it ain't no 1 6-month sentence, 1 year sentence. It's a whole different ball game. And we try to tell the policymakers this in places like DC, but they don't listen. They don't listen. And they push these policies where somebody can carjack somebody 8 times and still be on the street. All right? That's an injustice to that child. That's an injustice to our community. When you have policy with parents, right? The mayor got a lot of pushback because they say, okay, the mayor is cutting snap. Okay, I hate to be the mean guy, but $40 for 6 months is not going to help these women in our community, okay? You better off taking $26, $30 million and helping some women get off of TANF, and it be an example that you can jump off that cliff and try. A lot of our women are scared to try because they fear if they jump off the cliff, if they fail, they back to square one. So policy-wise, we got to ensure that these sisters have an opportunity to fly or fail, right? We also have to make sure people who don't want to try, you got to get up off your butt and try, because we shouldn't be taking care of you forever unless you have a mental health issue or some type of issue that can't be cured, And these are decisions that have to be made by policymakers. And sometimes they're tough decisions. But the reason why we're in the position that we're in, that we don't make tough decisions, but people have to understand, even with the thing, with the youth violence, right? People say, well, we can't lock our way out of this, right? But guess what? We can't kill our way out of this either. So we have to come to somewhere in the middle with our policies that we can really work to empower people in our community, make sure people get real equity in our community. It's not just about a SNAP check. It's about real equity and real opportunity, because that's what moves our people up. And we have to start having these real conversations. Sometimes they're tough conversations, but these conversations must be had and followed up with policy that's going to make a difference.
Thank you. Wow. That's the conversations that we're hoping we're going to have tonight. So thank you so much, Ron. And Jawanna, also, thank you so much for your transparency, because the realness of this, we can sit and talk and we can sugarcoat things, but the reason why we're doing this tonight is so that the community knows that we We want to know more about what's going on so that we can go and advocate on behalf of women and girls. So thank you all for your realness and your transparency. From the other panelists, are there any comments based on this last discussion on policy and the need for more policy, or how policy is effective or not?
Can I, Lori, if you mind?
Sure thing.
I feel
Yeah.
like I caught a stray from Ron there since I was the one who advocated for the SNAP increase. So let me just say this. One of the well, there are multiple things. So let me just start with it's not just women who receive SNAP. We actually have a healthy amount of seniors in the district who receive SNAP who are food insecure. And one of the reasons that we pushed for this was about health, but it was also out of the recognition that when someone can't feed their family, they end up doing desperate things. And that's what we're also seeing, right? When I have people who are stealing diapers from the CVS, usually it's not to go resell them. It's usually out of a need. It's usually out of a necessity. And that is not an excuse, but it is to say that there's a need that's not being met in that realm that we need to kind of address. But I would say for me as an approach in terms as a policymaker, like I listen to people like Ron. I'm not one who would say, for some folks, I think Ron said you need to sit down somewhere. I usually say you need to take a time out from community and you need and sort of reset, because when I look at when I talk to colleagues in other jurisdictions who have seen a decrease in crime where we are seeing an increase in crime, one of the things they talk about is that you could have resources all day long, but in the midst of chaos, none of those resources and none of those programs can take hold. You have to stabilize and then add the resources and the programs in order to do that. And I think we just have to be strategic in terms of how we approach those things. But I would also say that a part of this is that oftentimes, as a policymaker, I will tell you. So oftentimes I can look at my inbox right now. I think I have somewhere in the neighborhood of about 1,000 emails on a crime bill that we are about to vote on next week. And it's various opinions on things, and some are leading one way or the other. And I feel like, at least for some of my colleagues, they don't feel as though there's an ecosystem or they're hearing an echo chamber of things to say, this is what we want to support, and this is what we want to see happen moving forward. And so, when you have conversations like this, I just want to sort of underscore that it's so important for folks to be able to get involved. And perhaps we haven't done our best in the past of making it very accessible in order for folks to do that. I heard you, Jawanna, when you're sort of talking about I don't really pay the policy piece. P.S. I watched you and Ron on the panel yesterday over in Ward 6, and I thought you guys were very great and had excellent points. The thing is that, and I'm not saying this as an excuse, but I feel it's super important for people to understand the complications of our system here in DC. And I was listening to NPR this morning. They were talking about the 50th anniversary of Home Rule. And it's, folks will say, so-and-so's case didn't get prosecuted. And I'm like, okay, but I didn't pick the prosecutor. We don't control the prosecutor. The prosecutor comes from the federal government. It could change as often as the will of whoever is the president of the United States. And those are pieces that we don't control. I don't pick the judges. In other jurisdictions, judges are elected. Right. And so there are parts of this that I think are incredibly complicated, but I think Ron's, I'm going to call it a warning, if you will. We're already sort of seeing federal partners who are wanting to, quote unquote, engage more in terms of what that means on the ground. And I worry about what that, the federal government has never been known to be moderate when it comes to crime. They're heavy-handed. And so we have to figure out what is our best approach as that's not extreme on one way or the other, but there are policies in place that we need to rethink and see how we can sort of move forward in the best interest of the community.
Can I piggyback on that? So like as I was listening to you speak, I wrote down complications of the system, and I wrote down like a triangle. And at the top is the government. In the middle is, you know, people like me, and at the bottom is the real community. And like the more, and you know, I'm still in the community, I'm still down there, but the more up I go, the more I see the less of the community being there. Like the real people that's affected are not sitting at those tables. They are not telling you guys, this is, you know, like the meeting you see me at yesterday, we were talking about carjackings. We had kids in there that were carjackers. And I asked them, can they be put, you know, let the kids talk. Let them tell you what they want. Let them tell you. And they rather speak to me. They rather speak to everybody else. And the answer was right there in the room. So, you know, it just hurts my heart to see that, you know, like the kids are right there. They'll tell you why they're stealing cars. They'll tell you why they're doing what they're doing, but they're not at these tables. They have people at the tables that, I'm sorry to say it, but you know, 2 victims get shot, and one really, you know, it's a lot of stuff going on. I'll just say that. I'll leave it at that. I don't want to say anything too crazy, but yeah, that's how.
It sounds like we need to have some offline conversations so we can have some community discussions with the kids that are doing this and hear from them why they're doing this. So thank you for that. And thank you all again for this conversation. And Jawanna, actually, we're going to segue right into community engagement and activism. So thank you for that. And so Ron, this question is for you. Will you please share some examples of successful initiatives you've been involved in and how they've positively impacted the community? And even though I directed that question to Ron, panelists, please take this time and think, because I think all of you may be able to contribute to this question.
So I'm gonna give you I'm gonna give a little history of DC crime and things that happened. So 2002, J-Rock was killed in Ballou Senior High School, a star football player. After J-Rock was killed, one of the best things that was going on in DC was destroyed because policymakers, instead of saying, how do we make it safe for our children to be in schools, they took the programs out of schools. And the program they took out that was so important was the Metropolitan Police Department's program that they had in Ballou High School, where hundreds of children every day, you had to push them out the building at 8 o'clock to leave the building. And they built that police community relationship, right? They took that out of school, and gradually a lot of the after school programs were taken out. Then they took away all the go-go's for children. To this day, there are no all age go-go's for children to go to. Why? They started having violence at go-go's. So instead of doing what we did at Peace of Harless, we created a safe environment for children that were in gangs and crews to come after training, and they came to go-go's and we have no problem, right? So now you have all these children on H Street, U Street, National Harbor, and other places. Why are these children here? Why don't they go somewhere and let us be adults? Well, if you take away all the places, the safe places that we have for children, right, to go to, and they have nowhere to go like we had as children, guess what? They're gonna come where you at. And then we pay a price, right? Not to mention, we don't have no accountability for parents. You got parents that have children 12 years old out running the streets all over the city, and then when something happens to their child, it's all the fuss. But where were you at to make sure your child was in the house at 2, 3 in the morning? And nobody's making sure that that happens, right? I gotta call it like it is. Like, if we're not telling the truth, then we're not trying to get nowhere. All right. So then we had from 2004, we had an influx of like a lot of gangs and crews in the city. 2006, the city dumped a ton of money into collaboration efforts, including with MPD, where everybody came together as a united front and addressed this violence in our community. From 2008 to 2012, we saw the violence, the homicide rate in DC go down to the lowest level, I think maybe in 40, 50 years, if I'm not mistaken, right? Then politicians got, comfortable. Politics got in the way. They got rid of people like me and others because of political stuff, and the collaborations also start. And then a couple of years later, from that time on, the murder rate, crime has gone up ever since. All right, now you said, what are some of the efforts? During that time that we were talking when the crime went down, and before that, we had programs called Brothers Helping Brothers, saving our sisters to deal with 13 female gangs we had in Washington, D.C. And one of the things that these females had in common, when we were taking more retreats, all of them would say, when we let them speak, one thing we had in common, none of us had a father in our life, right? So we had to find ways to make sure these young sisters had positive male role models who weren't trying to be more than role models, right? Along with the women, the powerful women that we had in our organization. And these females, many of them are ANCs, some of them have run for office. We sent 160 children from rival crews and gangs to college. 40 of them, we did 40 truces with rival gangs and crews in Washington, D.C. We had another model called the Triangle in One that they still trying to do in D.C., haven't figured it out yet. But you have to be in the school, the community, and the institutions where young people go after they commit the crimes and work that together because they all are connected together. We had safe passage that we did with officers like Officer Buck. We work with the school resource office. When people say get rid of the school resource office, they really are not culturally competent to understand that you need police in the schools in this day and time. But we were doing safe pass before it was the safe pass. We would be riding the buses with the children. Something happened at the go-go in the community during the weekend. We call Officer Buckner, hey, hold them in the school before they get this. So we don't want this to come to the school, and we're dealing with it in the school before it turns into something. So we had things in place to deal with this stuff, right? And the last thing I would say is what I was talking about last night. It's much more, but I don't want to go on and on and on, was my problem with this system and what I call regressives. Because progressive mean we moving things forward. Regressive mean we moving things backwards. And these regressive policies where people do not listen, I've been talking to these people for 8 years trying to get them to listen to common sense practices. Common sense. They all up here keep bringing people from out of town in our city, have no clue, right? And they keep on driving us where we're going. So if a young person is released, because like Ms. Henderson said, under DC policies, many that we don't control, some that we do control, right? A lot of children are going to be released who commit these crimes, right? Fine, because you can still help them. But you got to have something in place where you're going to the school every day, checking on them, making sure they go to school. Because we know a lot of the children who commit the crimes are not going to school, right? Second thing, you going to their house. You making sure they make their curfew, right? Third thing, which is so important, most of the young people that we dealing with that have these violent offenses, their case management is 25-1. Most of them go home to a household where there are a lot of issues going on, right? We wouldn't even take the contract until they make this compromise for the case management to be 5-1. Because 5-1 allows that case manager to be like a surrogate parent in households where there are a lot of, things going on that shouldn't be going on, all right? Dysfunction, et cetera, right? So with that and activities and trainings and mental health services and all the other things that these children need in many cases, they've broken to pieces a lot of times, right? Sometimes it's that, sometimes it's children that have wannabe syndrome and they just following the trends that's in the music, that's in the video games, Grand Theft Auto and all these other things, right? And when you do these things and you do an effort like that, the likelihood of a child recommitting while they're out is not great. And because if they're not following this plan that was put in place by the judge and that they agree with, then they go back. And when they go back, we don't give up on them. We follow them into the system and we work with them again. We don't give up, right? Because it took me 5 times to get it. I went in 5 times before I got it, but thank God I went in. Because a month after I got locked up the last time, my brother got killed. 6 months after that, one of my best friends got killed, and I normally rode around with them. My brother and his best friend got killed together. So a lot of people don't understand this stuff. So when I go into a meeting and I interrupt your meeting because you won't listen, it ain't because I'm being rude. It's because I love my people. It's because I understand how these parents who come to me and say, I told him don't release my son. I told him he wasn't ready. I told him somebody was trying to kill him. And because you worried about keeping some numbers down to make yourself look good, guess what? My child is dead. And I'm gonna say this last thing. Other policy, Title 25, DC Public Schools. A child can assault a teacher and the teacher can't do nothing. Child can't be suspended after he assaults a teacher. How does that even make it on the books? How does that make sense? This reminds me of the same people that tell me I can't discipline my child, but then when something happens, you want to hold me accountable. All right? The criminal justice system. The police used to be brutal in DC jail at one time to inmates, right? It got better. But then in places like DYRS, the young people started assaulting the officers, right? Guess what? You can't get people to work in the jail. You can't get people to work at DYRS. You can't get people to work at the police department, right? So when you can't get people to work at any of these entities, guess what? It automatically becomes unsafe for the same people that we're trying to protect. So there are a lot of policy things and balance that has to come in, right? So those are the things that I want to say around policy and my experience.
Wow. Thank you, Ron. That warrants a part 2 just in itself. The real-time, real-life experiences and insight that you have to offer to the district and to this conversation.
Absolutely.
So again, thank you. But I am getting the bell because we have exceeded our time, which is great because when conversations happen like this and we're past the time, that means we've had a great conversation. And Angela, that means we're gonna have to do a part 2.
We definitely are. We didn't even get a chance to stream the fireside chat which was phenomenal too. That Lori had an opportunity. Sister Lori had an opportunity to do with Councilmember at Large Kenya McDuffie, which was super incredible. Author of the NEAR Act here in the district. But we have 10 more minutes, so I want to have an opportunity to take questions from our great attendees who have been engaged. We have not had many people drop off. If they did drop off, maybe they had to go do something in the house or with their kids. But we've had an engaged participant list. We've had up to 60 people on this webinar. Right now we're at 50, so it's okay, right? But this has been a super engaging conversation. And I think we brought a lot out from all of you from different aspects. So I want to just say thank you before I jump into some of these questions. So one of the questions, Jawanna, this one is for you. How do we get more children to the table to speak?
That's a good question. Yeah, I mean, people reach out to me. People are starting to get to know, go to those neighborhoods. I mean, that's how I meet with kids. Like, you'll be surprised, like, just getting to know kids, volunteering at the schools. But me, I mean, I'm a little different, but just to go back up to my nonprofit, a kid would get shot, or a shooting would happen, and I would respond to the scene with snacks and love. And that's how I built with the families and the kids. And when you talk about community and what works, it is really tough to say because, like, in my position, I work at Children's National as a violence intervention specialist. And thank God I can be creative because when I first started, and I'll make this really quick, I work Monday through Friday, 9 to 5. And, you know, and they're like, Ms. Hardy, you can cut the phone off at 5. And I'm like, but everything goes on after 5. So literally at Children's, my kids that I work with, my phone is on 24/7. Like, it's no weekends. And I realized Monday through Friday, they really don't need me, you know, like at that time, 9 to 5. So that's one thing. So yeah, but I know I don't have a lot of time. So I'll be
No, thank you. I appreciate you being succinct in that response. And I think it's super important for us in terms of adults, right? And I used to work at America's Promise Alliance, and one of the key factors for young people to thrive, the number one thing is a caring adult, right? So having access to that, especially when some of our young people just don't, because mom is working all day, dad is working all day, you know, so we have a lot of latchkey kids that are coming up in our community. We have a lot of younger parents that are raising their babies, and they're raising their own babies, right? So it's important for us as a village to come together to support our youth. So thank you so much for that. Another question, this is for Commander and Ron. As we know, the district, Northwest, Southwest, Northeast, and Southeast are virtually landlocked. Crime crosses the borders. What is taking place in terms of interjurisdiction planning for law enforcement, crisis response, nuance reduction, and especially youth empowerment? And I think Councilmember Henderson, you can also chime in and lean in here too. So any one of you can take a shot at that response, to responding to this question.
That was a mouthful, so a lot to unpack.
I know, it was.
in a little bit of time, but I'll just speak on MPD's kind of action, and I'll pass it over to Ms. Henderson. So just in terms of crime crossing, you know, northeast, south. So what you guys kind of don't see sometimes is like the commander. So all the district commanders, we meet every single day, every day without fail, to discuss what's going on in these areas, and what may be working for you up there, what may be working for me down here. And we are we're in lockstep. Like, we talk so much so that, you know, your family members are like, hey, can I get a few minutes in here? But, you know, it's going to take that, right? It's going to take that, because I think for the first time in a long time, and Ron probably can jump in on this, like, crime is not bound. Like, you usually would look and think, oh, this is only happening in Ward 7 and Ward 8. Absolutely not. You know, you're starting to see that crime, you know, it's creeping, it's up northwest, you know, it's creeping towards Georgetown, City Center, you know, all these places, right? So it's a constant need for every one of us to kind of be in lockstep with strategies and tactics that can, you know, kind of help. And it's gone beyond quadrants of the city. It's gone beyond to agencies outside of DC, that we're all in lockstep. Hey, what's happening on the border of Southern Avenue in Maryland? Because it's coming this way. You know, so let's get on the call. Let's start talking about that. So I think agency wise, we are locked in on whatever we can do to kind of slow this trend down.
Thank you.
Yeah, I would just add to what the commander said. We even saw this week in terms of a double shooting in the district that ended in PG. And so we've seen, I think, and the commander probably can speak to this, right? A lot more incidents where a suspect gets arrested and their address is not the district. It is in Maryland and other places. And then I think also too, one thing that we have been on the council sort of trying to push the executive on is that we have too many guns on our streets altogether, right? And when you think about DC's laws, there's not a place, like, we don't have gun shops. You can't walk in and say, I'd like to try out a Glock or whatever, and then, you know, submit to a background check and do that. We have some of the strictest gun laws in the country. Mm-hmm. And yet, I think even last year, there was like over 3,100 illegal guns that were recovered in the District of Columbia. They're coming from somewhere, mm-hmm. right? And so it behooves us to have these conversations with other jurisdictions around the gun trafficking that's happening. It's coming from, I think, as far as south as Georgia and other places where it's making its way into the district. And so, you know, to the questioner's point, this isn't something that DC alone can solve, primarily because we can't seal off our borders. Right. We can't, as much as we might try, we can't put a checkpoint at every entry point into the district to search someone's car to see what they're doing and if they're coming into the district to cause havoc. And so the intrajurisdictional planning and communication is something that we just, you know, we have the real-time crime unit that's coming on board, the additional pieces with our federal partners. And I think that hopefully this will help us crack down on some of this.
Thank you. Ron, did you have anything you wanted to add?
I was going to say, we have to be just as serious about this as we are about how we do. If you got a ticket in Maryland, you can't get your tags in DC. You know what I'm saying? You know, we serious about that. in the past, we had this unity on the board, this collaboration. We did a lot of work with Reverend Tony Lee and leaders in Prince George's County. I work with my guy, Michael, out in Alexandria and other places. And we try to bring law enforcement together, working with young people across the borders. Because a lot of these children we're talking about, they have family members in Prince George's County and Virginia, right? And they go back and forth. Some of them are couch hopping, back and forth across the line. So they got places to run to when they commit crimes. Some of them are unstable. They go back and forth across the line. So it's very important that the communication happens across the lines, because these children and families are often in transition because of financial reasons or whatever it might be. They move. So we have to understand that we have to move with them, but also have a collaborative effort in doing that. And we have done that in the past. And the other thing I want to say, and I left this out, one of the things that people have to understand is all this stuff is a ministry. The minute it becomes a job, you're not going to be effective. So if you look at this work as a job and it's not coming from your spirit, I don't care who you are, you're not going to be good at it.
Yes.
And I give you a prime example. Without a dime from DC government, they had over 200 gang members that were going down Gallery Place every single day. And the government didn't give me a dime. It was a gay gang called Check It. As you go Google it, it's a documentary done on it by the actor Steve Buscemi. I went to Chief Diane Grooms at the time and met with her. We had a meeting with 13 leaders from that gang in Gallery Place, asked them what they needed. I helped them start a fashion line. We did fashion shows with them. We made the police start respecting them who were calling them out their names down Gallery Place. I made them start respecting law enforcement. And eventually, we got them out of Gallery Place. Two of those leaders from Check It own property with me on Martin Luther King Avenue right now. So what I'm saying is, a lot of this is spiritual. It's spiritual. But what upsets me is when we get all these people who making decisions and they know who's made a difference in this city, right? And they just lucky that I'm just 54 now. And I just don't go as hard as I used to. But if I was old Ronald Moten, they wouldn't be able to walk in the Wilson building because they don't listen. They do not listen until something tragic happens. And then everybody wants to act like, oh, we care. No, all you got to do is listen.
Well, thank you, Ron. I think we are all listening to you. We have to, right? You are a voice to be reckoned with, and we appreciate you being on this. Not only just being on this webinar to provide such good feedback, but also the work that you're doing in our community and the impact that you're having on Black men and Black girls, right? So we thank you for that. Black women and girls, we thank you for that. We are at 8 o'clock, everyone. And I want to make sure that I allow our first Vice President of Programs, Mrs. Sharon Wilder, just provide a few words, maybe 60 seconds words before we close, because she oversees our programmatic committees here at the 100. So I wanted to give her the floor to share some words before we close. Sharon?
Well, it sounds like, y'all, that we need a part 2, because this has been an absolutely amazing panel. And I still have so many questions. I've got so many comments, but I will limit myself. But definitely a part 2 is necessary. And if I could invite you all back to do that, that would be awesome. It sounds like there's some topics that are before council now and that should be before council now that we really need to be a part of. And I know our sister Lori Amos, who's chair of our public policy, will make sure that the 100 sisters are there in support of where we can be and help to provide testimony or what have you. So Councilmember Henderson, we're your group for that. And I just want to thank you all for taking your time out this evening, for not only being here, but sharing so passionately about your stories, and for the sisters and friends and others who are in the audience, I thank you for taking your time out. You will be hearing from us about next steps and how we can continue this conversation going forward. So with that, thank you so much, Sister Angela, for putting together this wonderful program. I appreciate your work.
Thank you. Thank you so much. And I would be remiss if I did not thank my village who was on the line, not just my mom. My dad made sure to let me know he's in the building too. And I have to say that because when we talk about the impact of crime and its effect on Black women and girls, I'm a Black woman and I once was a Black girl. And because I had two parents that made sure they invested time in me, that I had safe places to go, checking on me, even though I tried to be slick and do my own thing on the side. They made sure that I was safe. They made sure that I had access to the things that I needed, and they surrounded me with other caring adults like Jawanna Hardy, to support me in my upbringing. So I just want to formally say thank you to my parents as they're on this call supporting me in this capacity, because I would not be where I am today if it were not for them and for them showing me to build coalitions with my sisters at the National Coalition of 100 Black Women. So I just want to say thank you. Thank you to Sister Lori for being an amazing moderator and for just stepping up and always saying yes. Thank you to each of our panelists. Oh my God, I'm just blown away by the conversations that we've had. I think that we will need a part two. We have so much more to talk about, and I think we need to continue to work together to create solutions for our Black women and girls as we think about the rise of crime in our city and its impact on our psychological health. And I just want to thank all of our attendees for joining us and staying with us. This was not a boring conversation. This was not a lag. Like, this was such a needed conversation that we had. And I would be remiss if I did not thank my entire health committee for working so hard to put this webinar together. This webinar was definitely a dream that became a reality. And I can't take all the credit for something that I literally came into. I became the health chair in December. So I have to thank my predecessor, who happens to be one of my best friends from Howard University, Elise Newhouse, who is now our third VP of membership. Thank you so much, Elise, for setting the tone and setting the vision for this committee. I am so honored to stand on the shoulders of you. So thank you so much. And if all of you aren't following us on social media, please make sure you are. We can be found on every social media platform at NCBWDC. So please sure to stay connected with us, our entire chapter, and our health committee. We have a program called Hands on Heart, a Heart Health Awareness Month event, focusing on life-sustaining and life-saving heart techniques and promoting healthy heart behavior. So that's on Saturday, February 24th at the Anacostia Public Library from 11 a.m. to 1 p.m. So make sure you stay connected with us. Thank you all so much for joining us and have a great night.